Hello, and welcome to our Safe Infant Sleep and Breastfeeding Party. My name is Lorena Kaplan, and I lead the Safe Sleep campaign at NICHD. And joining me today is Dr. Sahira Long, a pediatrician at Children's National Hospital and a lactation consultant. Thanks for joining us, Dr. Long.
Thank you for having me.
Well, today's event kicks off our week-long Safe Infant Sleep social media blog party, the first one ever. And each day, experts will share helpful tips for how everyone who cares for babies can practice safe sleep. And you might ask, why is this a party? Well, to mark SIDS Awareness Month, October, NICHD and its partners are celebrating babies, parents, caregivers, health and service providers, and advocates. And this includes you, Dr. Long. As a mom yourself and a healthcare provider, you're also a champion of safe sleep. And this entire event is in celebration of you and others like you who help babies sleep safely every day. So for those watching, please tune in to the other parties. Again, this is the first of four, and you can find the details in the comments below. And because we're in a partying mood, we're also celebrating how far we've come since the early 90s to save thousands of babies' lives by practicing safe infant sleep. And Dr. Long, I hear, has a fun surprise for all of you who tuned in today.
That's right. To help recognize the work that all of you do to keep babies healthy and safe, we're giving away party favors to a few lucky participants from today's event, courtesy of Children's National Hospital. To join our giveaway, all you need to do is one simple thing. Ask a question in the comments section below, and we'll randomly pick 3 participants to receive branded onesies from Children's National. After the event ends, someone from Children's National will contact the winners via direct message on Facebook, and anyone who posts a question in the comments is eligible for a prize. Not only will we be giving away party favors, but we'll also be responding to your questions in the comments as well.
That's great. Thank you, Dr. Long. Am I eligible?
Sorry, Lorena, I don't think so.
Okay, fine, next time. Well, I am excited to see who wins the prize, and I'm looking forward to answering some questions in partnership with you. So now that we hopefully have our guests' attention, it's time to get the party started. We know safe infant sleep and breastfeeding are important topics on their own, and they often go hand in hand, which is why Dr. Long is going to share some tips for how to practice safe infant sleep while breastfeeding. Okay, Dr. Long, to get us all on the same page, would you please give us a quick refresher on what parents and caregivers can do to keep babies safe during sleep?
Sure. So in order to reduce the risk of SIDS and other sleep-related deaths, the American Academy of Pediatrics, or AAP, recommends a few things. I'm not going to go through everything they recommend, but a few key practices. So the first is always placing the baby on their back when they're sleeping. The second would be to use a firm, flat sleep surface that's covered by a fitted sheet. The surface should be free of all other items, including soft and loose bedding, toys, and crib bumpers. The third tip would be to share a room with the baby, but not a bed. And the fourth would be, of course, the reason I'm here, breastfeeding or feeding your baby breast milk, ideally for at least a year.
Excellent, thank you. And by the way, you're always welcome, so that's not the only reason you're here. Okay, well, as Dr. Long said, the AAP has more recommendations for safe infant sleep, but these key practices can help to create a safe sleep environment for babies, so please be sure to follow them. And we encourage our viewers to visit the Safe to Sleep campaign website for more information. But for now, we'll keep focusing on safe sleep and breastfeeding. So we know breastfeeding is good for moms and babies for a lot of reasons, including SIDS risk reduction. Dr. Long, can you give us some details about why breastfeeding is protective against SIDS?
So as much as we know, we still don't know exactly how breastfeeding protects babies against SIDS. But we do know that at least 2 months of breastfeeding lowers the risk of SIDS by almost half. And the longer a baby is breastfed, the greater the protection. So at least 2 months, and the longer you do, the better it is for the baby. For example, breast milk has antibodies that can protect babies from some respiratory infections that can increase their risk of SIDS. And also, breastfed babies are easier to wake up than babies who aren't fed breast milk.
Ah, okay. So I know that I've heard people call babies who sleep through the night good sleepers, but it sounds like that might not be the best for baby, and that a baby who wakes up regularly to feed is a healthy baby. Is that correct?
That's right. So, in the early months of life, babies that sleep through the night is actually a scary thing for a pediatrician. I know parents love it, but we pediatricians stay up at night worrying about babies who don't wake up to feed at night.
Okay, good. That's good for everyone to keep in mind. A baby that wakes up regularly is a healthy baby. Okay. So we know that a part of practicing safe infant sleep includes planning for the inevitable, and so much about babies is unplanned. And we know it's true that parents and caregivers want to keep their baby safe when they're awake and when they sleep. But parents are often very tired when they're taking care of their beautiful new baby and with everything else that's going on in terms of how their life is changing. So, what can tired parents and caregivers do to practice safe infant sleep while breastfeeding?
That's a great question, Lorena. So, the first thing I tell parents is to plan ahead for the chance that they might fall asleep. Um, Many parents, myself included, many years ago, my youngest is 6'5" and 15 now, but many years ago, I brought him into the bed with me for feedings at night. And even if it wasn't my intention, fell asleep. So, in order to help make our bed safe and something that parents can do to help make their adult bed safe, they can first remove all soft items from the bed, including pillows and comforters and anything that might move around while the baby's in the bed. And second, if you do happen to fall asleep, not planning to, as soon as you realize that you've done so, put the baby back into their own sleep space as soon as the feeding ends or as soon as you wake up and realize they're still there. In our family, that was one of my husband's duties to help keep our babies safe at night. So he would change the babies before bringing them to be fed and then stay awake with me until the feeding was over so he could return the baby back to the bedside bassinet. If someone doesn't have anyone at home with them to help keep them awake, they can actually use their mobile phone timer to do the same thing. And if parents are using any tobacco, that should be avoided because that increases the risk of SIDS. And also, alcohol and drugs or anything that might make it harder for them to wake up increases the baby's chance of not making it through the night.
Okay, those are great tips. Thank you. And it's so important for us to keep in mind that the technology we use every single day can, help to keep baby safe at night, and mom awake or whoever's feeding the baby. So that's a great tip. And also, I like what you said about it's not enough to create a space for baby on the bed. We really just have to plan kind of for the worst and remove all that soft bedding to make it a less risky space for baby. So thank you for those tips. Okay, so continuing with the theme of planning for the inevitable, something else that comes up for families is the issue of unplanned sleep surfaces like couches or armchairs. I mean, how many times have we fallen asleep on the couch just watching a movie, right? It happens. But evidence shows that feeding babies on a cozy couch or armchair is very dangerous, especially if there's a chance that the caregiver might fall asleep. So can you tell us why caregivers should try to avoid feeding on these surfaces altogether?
Sure. And it's funny you asked about or mentioned falling asleep while watching a movie. My husband does that all the time on the
Me
movies
too.
he picks. So,
Yes.
as far as sleep or feeding on a couch or an armchair, the first thing to think about is there's really just not a lot of room on couches and armchairs. So it's easy for a baby to get wedged between the sleeping parent and the cushions of that chair. And babies also can fall off the couch, which is a whole nother reason to avoid the couch. So one of the studies that the AAP used to help inform its safe sleep guidelines found that babies who sleep on a couch or armchair with an adult are up to 18 times more likely to die than babies who sleep separately from their parents. And I'm going to say that again because it's important. More than 18 times more likely to die if the baby sleeps on the couch or armchair with the parent. Um, Babies can suffocate if their nose or mouth are accidentally covered by the parent's body, cushions, or blankets, which is going to happen more easily if you're in a couch or an armchair with limited space. So, as the AAP recommends, I typically tell parents that unless they're fully awake with no chance of falling asleep while feeding, it's best that they avoid couches and armchairs altogether. Instead, they can plan to feed on the adult bed that's already been made safe for the baby, where all soft bedding and pillows has been pulled off. And if they do fall asleep while feeding on the adult bed, as soon as they wake up again, they should return the baby to its own separate sleep surface, like a crib or bassinet that's next to the bed, but not close enough that it's in the bed.
Great, thank you. What a scary statistic. It gives me chills. Almost 20 times higher, 18 times higher likelihood that something awful will happen on these surfaces. That's certainly something to avoid 20,000 times by not falling asleep on couches or armchairs with babies. So thank you for sharing that very scary statistic. Okay, so while we're on the topic of adult beds and other soft surfaces, let's talk about bed sharing. So I'll say up front, every family is unique, and so are their caregiving practices, and we honor them. But some parents and caregivers share the same room with babies, so room sharing, and some share the same bed, bed sharing. So what do you advise parents and caregivers when you talk to them about where baby will sleep?
So first, Lorena, I mean, let's be honest. Every baby would probably prefer to sleep next to a parent's warm body. I mean, we're mammals. That's how we're wired, right? But the risk of a sleeping parent rolling over and accidentally suffocating their baby, to me, just isn't worth taking a chance. The risk of injury and death is higher, like I said, if there's any alcohol, tobacco, or drug use involved. So I typically advise parents that if space allows in their room, that they should keep the baby in a separate sleep area, such as a portable play yard, bassinet, or bedside sleeper. And that area should have nothing in it except the baby. No blankets, no pillows, no toys, or so blankets, nothing thicker than a receiving blanket is what I usually say. That way the baby can be close to the parent without being in the parent's bed.
Okay, thank you. What about that super cute blanket that grandma crocheted or knitted?
So I'm a crocheter, and I'm gonna say this: what I tell my people that I make blankets for. This blanket is not for the baby to sleep with. It's for all the cute pictures that you're gonna send me. So it should not be in the bed with the baby.
I like that. Thank you. And another thing, just for clarification, a bedside sleeper. I know when I talk to folks about the different sleep spaces, that's one that folks aren't as familiar with. Can you tell us how that one works?
Sure. So we actually had one for my second child. We learned, I said, what I think it was Maya Angelou, when you know better, you do better. So with our second son, we actually purchased one, and it has straps that go under the mattress. And then there's a piece that anchors it to the bed so that it can't move away and have the baby accidentally wedged between the bed and the sleeper. And it's great. The side of it comes down, so it's almost flush with the bed mattress, but it's a separate sleep surface that the baby can be put in much easier than having to get up and move to go put the baby down.
Gotcha. So
And
for
we
breastfeeding
actually,
mamas, that's probably like a good thing to keep in mind, right? Proximity,
it
but not in
is,
the same bed.
right? My son was able to stay in his bedside sleeper until he was probably about 9 months when he started climbing off the side of it. Not,
Okay. Good time to
yeah,
move him out into his own crib, probably.
yes.
Well, thank you, Dr. Long. Those are super helpful tips. Also, some scary statistics, folks. Please, please pay attention to what Dr. Long is saying. And again, we know this can be a very personal and sensitive topic to address with families. So we appreciate your helpful advice, Dr. Long.
No problem.
And I don't want to be super selfish, so I got my questions in, but I know that over the past few weeks, we have received several questions from service providers and parents about how to practice safe infant sleep and breastfeeding. So I will share my time with them too. So let's pick a few for you to answer. All right, let's see. Okay, here's a good one. What advice do you have for parents who say that the baby doesn't like to sleep in its own space?
That's a great question and an issue that comes up often. For me, the trick is being consistent with putting babies to sleep in their own space. But there are a few things that you can try to help babies get used to that separate space. This came up with my first son. Like I said, when we knew better, we did better. Who would scream when we put him in the bassinet initially, and it was right next to the bed, not on the bed, not attached to the bed, but right beside it. And what we found that helped was if we wrapped his bassinet mattress in one of my t-shirts that had my scent on it, he would sleep better. So we think he recognized my scent, since babies are born recognizing their mother's scent after that long, hopefully 40 weeks on the inside. And that helped them. If you try this, it's really important to make sure that the shirt is as thin as a sheet would be, and also to make sure that it's wrapped tightly enough that it can't accidentally move or bunch up. And you can also try wearing the fitted sheet that is supposed to go on the mattress for a few hours before the baby's nap or nighttime sleep. For us, I think the nighttime sleep was the hardest. It seemed like he would fall asleep wherever he was placed during the day. But whatever that sleep is that you're having trouble getting the baby to sleep separately, wear the fitted sheet that's going to go on the bassinet mattress for a few hours so that your scent can get on the fabric. And then you can put it on so that the baby recognizes your scent and still practice safe sleep. Either way, baby sleep safest when they're on their own separate sleep space.
Gosh, that is such a creative, soothing tip. I don't know that, I've ever heard anyone share that. So thank you for sharing it with our viewers today and with me. That's definitely a good one to write down. Okay, so here's another question. What can parents do if there's not enough space for a separate sleep surface?
This can be a really challenging situation, Lorena. If a family doesn't have enough space for their expanding family, then there's often a challenge finding a separate space that they can put the baby to sleep. So over the years, and I'm not going to say how many years I've been working, but I've heard lots of creative solutions that parents have tried. One is using an empty dresser drawer or a laundry basket that has nothing in it but the baby. The most important thing to make sure is that whatever solution is used is the safest option for the baby. So again, if they're going to go into anything, they need to be alone, no toys, no pillows, and no blankets thicker than a receiving blanket.
Great, thank you. Again, some creative solutions for parents. And just to make sure I understand, the dresser drawer, that's one that is out of the dresser, empty, and on the floor with nothing but the baby?
Correct.
Okay, perfect. Thank you. All right, here is another question. How can I talk to families about practicing breastfeeding and safe sleep when they already told me that they plan to bed share?
Yeah, that's another tricky one. And I must say it comes up far too often in practice. So for anyone working with the family, it's important to understand the motivation behind bed sharing and to use open-ended questions that are non-judgmental when having a conversation with parents and caregivers. Once you have an idea what's driving their decision, then you can start to respectfully explain the reasons behind the safe sleep recommendations, and also allow parents and caregivers to ask questions and work through some sample scenarios. You can also offer to help the family make a breastfeeding and safe sleep plan that reduces the most common risk associated with bed sharing, helps keep the family or helps the family to keep their breastfeeding schedule and goals, and also keeps the baby healthy and safe. At the end of the day, what every parent wants, what every pediatrician or child health care provider wants, is a safe, healthy baby.
Absolutely. And I so appreciate you really keeping us on track in terms of how to talk to parents and really being non-judgmental and seeking to understand, not judge, and not just tell. Um, sometimes we don't have enough time to have those thoughtful conversations, but I feel like if we don't start with thoughtful conversations, it's not going to go anywhere, and they're just going to shut down and do a potentially risky thing without having all of the information they need to make an informed decision. So thank you for giving us those tips. And just so we're all clear, can you give us an example of an open-ended question?
Sure. So I think of open-ended questions as questions that can be answered with yes or no. So instead of asking, do you like this? You can ask a parent, tell me what you like about this. Or for safe sleep, it would be, so tell me what you've heard about bed sharing, or, anything that helps the parent to speak what's on their mind and not just answer with one word.
Great, thank you. And that probably helps to start to build a relationship with the parent if they feel like they're being heard. So I imagine that's helpful.
Yes, and the biggest thing, I mean, parents need to feel safe to be able to share what they really are doing at home. If they think they're going to be judged or attacked, then they're just not going to tell you, and you won't be able to help guide them to make the safest decisions for the family.
Yeah, that absolutely makes sense. Thank you. Okay, Dr. Long, well, we've covered a lot of ground today. Thank you so much for taking the time to speak with us today and answer a few questions. Because we covered so much good information, I wonder if you had to summarize key takeaways from today's discussion, what would they be?
Okay, so if I had to summarize our conversation, the first thing I would say is that breastfeeding for at least 2 months reduces the risk of SIDS by almost half and has many other health benefits for both the mom and the baby. We know that the longer a baby's breastfed, the greater the benefits for both the mom and the baby. The second would be bed sharing is not recommended. Your baby is safest in their own sleep space, such as a crib, bassinet, or portable play yard that's in your room. Third would be if you're tired and might fall asleep, avoid couches and armchairs when you're feeding your baby. Instead, consider feeding your baby on a bed that's free of all pillows and blankets. Finally, planning ahead is key. So if you have support people available that can help you keep your baby safe, great. You can ask them to help you remove all the soft items and bedding from your bed if you plan to feed your baby there. And you can also ask them to place the baby back in their own separate sleep surface after the feeding's over. If you don't have a support person, that's fine too. If you have a cell phone or any other portable electronic device that has a timer on it, you can set a timer to help you stay awake during the feeding or to remind you to put your baby back in its own sleep space when you wake up.
Gosh, those are great tips. Thank you for summarizing. I want to make sure that we keep all those good takeaways fresh in mind so we can share them with parents. And certainly this is important information, not just for people like me, but it's also good to keep in mind for breastfeeding moms and families and other helpers who are trying to help the parents adjust and make sure that that baby grows up healthy and safe and ideally happy. So thank you to all of our viewers for joining today's Safe Infant Sleep and Breastfeeding Party. We hope you enjoyed it as much as we do. I don't know if you could tell, but we had a blast. So please
Yes, it was
know that
great.
we hope you found this information useful.
Yes, this was great, Lorena. Thank you so much for having me. And also thank you to everyone that joined us for the Safe Sleep Party.
Absolutely. And just a reminder that we are still taking questions in the live comments. So if you have any questions about safe infant sleep and breastfeeding, please post them in the comments below and you'll get a response directly from one of us.
Right. And don't forget, for those of you who post questions in the comments, you'll automatically be entered into the giveaway, where 3 people will be selected to receive a onesie courtesy of Children's National Hospital.
That's great. All right, well, we look forward to seeing those questions, answering, engaging with you. So please be sure to send us your thoughts and questions. And check out the comments below to see when the other Safe Infant Sleep parties are happening this week. Again, there's 3 more, and they're going to be amazing. Also, a reminder that our Safe Sleep Snap activity on social media is still going on. The last day of this activity is October 31st. And we invite you to post cute pictures of babies in safe sleep environments or maybe in fun costumes as long as they're safe. And we also welcome pictures of parents practicing safe infant sleep and breastfeeding. They're very much a part of this entire activity. So as much as we don't want to, that's it for today's party. We must go, but please know that we are keeping you in our thoughts. We certainly hope you find this information helpful. If you like it, please let us know so we can plan for next year's social media party. But in the meantime, stay safe, stay well, and help us keep the party going by practicing safe infant sleep every single day of the year. Thank you so much. Thank you, Dr. Long. We'll see everyone soon.
Thank you.